On December 31, 2019, the World Health Organization's (WHO) China office heard the first reports of a previously unknown virus behind a number of pneumonia cases in Wuhan, a city in eastern China with a population of over 11 million. What started as an epidemic mainly limited to China has now become a truly global pandemic. There have now been over 566,269 confirmed cases and 25,423 deaths. According to the Johns Hopkins University Coronavirus Dashboard, the disease has been detected in more 196 countries and territories, with Italy, the US and Spain experiencing the most widespread outbreaks outside of China. In the UK, there have been 14,579 confirmed cases and 758 deaths as of March 27. So how did it start? The disease appears to have originated from a Wuhan seafood market where wild animals, including marmots, birds, rabbits, bats and snakes, are traded illegally. Coronaviruses are known to jump from animals to humans, so it's thought that the first people infected with the disease was a group primarily made up of stallholders from the seafood market. What exactly is coronavirus? Coronaviruses are a large group of viruses that are known to infect both humans and animals, and in humans cause respiratory illness that range from common colds to much more serious infections. The most well-known case of a coronavirus epidemic was severe acute respiratory syndrome (SARS), which, after first being detected in southern China in 2002, went on to affect 26 countries and resulted in more than 8,000 cases and 774 deaths. While the cause of the current outbreak was initially unknown, on January 7 Chinese health authorities identified that it was caused by a strain of coronavirus that hadn't been encountered in humans before. 5 days later, the Chinese government shared the genetic sequence of the virus so that other countries could develop their own diagnostic kits. That virus is now called SARS-CoV-2. How does the coronavirus disease spread? The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. To protect yourself, clean your hands frequently with an alcohol-based hand rub or wash them with soap and water. What are the symptoms of coronavirus? Coronavirus shares many of its symptoms with the flu or common cold, although there are certain symptoms common to flu and colds that are not usually seen in coronavirus. People with confirmed cases of coronavirus rarely suffer from a runny nose, for instance. The most common coronavirus symptoms are a fever and a dry cough. Of 55,924 early Chinese cases of the disease, nearly 90% of patients experienced a fever and just over two-thirds suffered with a dry cough. That's why the UK government is advising anyone with a high temperature or a new, continuous cough to stay at home for 7 days or, if they live with other people, for the entire household to isolate for 14 days from the first onset of symptoms. Other coronavirus symptoms are less common. Just under 40% of people with the disease experience fatigue, while a third of people cough up sputum, a thick mucus from within the lungs. Other rarer symptoms include shortness of breath, muscle pain, sore throats, headaches or chills. According to the WHO, symptoms tend to appear between 5 and 6 days after infection. What is the treatment for the coronavirus disease? There is no specific treatment for disease caused by a novel coronavirus. However, many of the symptoms can be treated and therefore treatment based on the patient's clinical condition. What should you do if you think you have the coronavirus disease? If you have fever, cough and difficulty breathing, seek medical care early. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek medical attention and call in advance. Follow the directions of your local health authority. What can I do to prevent the coronavirus disease at home? Remind everyone in your household of the importance of practicing everyday preventive actions that can help prevent the spread of respiratory illnesses. Avoid close contact with people who are sick. Stay home when you are sick, except to get medical care. Cover your coughs and sneezes with a tissue. Clean frequently touched surfaces and objects daily, e.g., tables, countertops, light switches, doorknobs, and cabinet handles, using a regular household detergent and water. If you like the video, give it a thumbs up, subscribe to the channel and share it with your family and friends. There will be some very helpful resources in the description, so don't forget to check them out.